Hello and welcome back. This is the Datapalooza stream again. My name is Fred Trotter. I'm a healthcare data journalist with CareSet. And Datapalooza is by far my favorite conference, and my favorite organization to run conferences is Academy Health. And the person who is newly in charge of Academy Health is here with us, Dr. Aaron Carroll. And I say Dr. Carroll runs a very successful podcast and is old hat doing this. And he was actually just explaining how he's got this amazing camera set up, and which is, I think, the best, certainly better than mine. We're going to be learning from him not only about Datapalooza and the conference, but also how to do this better. So with that, Dr. Carroll, you are new at Academy Health. What is your kind of introduction to the Datapalooza community? Who are you and how do you come to be on the center of this stage, but also at the center of the stage on Datapalooza? I think you are opening the conference. Is that right?
I believe I am, which will be great. And first of all, thank you for having me. It's a real pleasure. But I'm a pediatrician by training, but I've been a health services researcher for my entire career. But I've also been an informaticist. In fact, almost all of my funded research, especially at the beginning of my career, was in how do we use clinical decision support and how do we use electronic medical records and all the data that we might collect from patients that might not be in a medical record to help pediatricians practice better, more evidence-based medicine. We used to do randomized controlled trials of a clinical decision support system that we designed ourselves. Back in the day, it had to be filled in on paper and then scanned in. This was all pre-tablet. Then we shifted to tablets. We've done a lot of work in medical decision making, in the use of data to help make better, more cost-effective decisions. A lot of my career has been focused on how do we take data, both the data that's been collected already in the practice of healthcare, but also data which exists outside of healthcare, or that we could find in other different ways that might be just as important, if not more important, and try to use that to improve health and healthcare. So the focus of Datapalooza, is right in the center of my heart. How do we use data and technology to move beyond just documentation issues to identify and pilot and figure out novel solutions to make things so much better?
So we briefly met, I think, at a light stop outside ARM, and of course we're going to put into the show notes. We'll try to put in the show notes all the acronyms we use. ARM stands for the Annual Research Meeting, which is this big meeting that happens every year that Academy Health puts on. It is the show. It is the place to be if you are a healthcare researcher. Datapalooza is a different conference. It works a different way, but I see every year at ARM, I try to go. I think we go about a third of the time we're able to make it to ARM. We try to go to Datapalooza every year. But I see more data at ARM, and I see more every year. I see improved clinical research topics at Datapalooza.
Yep.
When you are at a Health Datapalooza, if you can contrast with ARM, but in general, what are you excited about for your? And have you ever been? This is your first year.
Well, I think this actually might be my first Datapalooza.
Okay.
Ironically enough, just because of scheduling conflicts, it just sort of was never able to fit it in the same way I was some of the other meetings. But it's a very different meeting than ARM. ARM is much more of a traditional academic meeting where almost everything has been sent in the form of abstracts, and then there'll be posters, and then there'll be sessions that discuss the science and the methods, and even the plenaries. Although the plenaries have changed a bit, it feels much more like a traditional academic conference. Health Datapalooza is very different. It is much more focused on, I'd say, real-world solutions, and has very different sessions, from pitch tents to unconference sessions. The plenaries are going to be more single topics by people you definitely want to hear from. They're going to be shorter. They're going to be more focused, again, I think, on real world solutions and less on studies and research, and really focusing on how people are making meaningful, use of data and overcoming challenges that everyone who works with data in health will face. Things like interoperability and privacy, and the things that really matter in how do we get things done, as opposed to looking much more at the research and trying to get to more of the beginning of it. As an example, there's a plenary on storytelling. which I'm really looking forward to. And that's the kind of thing I think you would see more at a Health Datapalooza than you might at ARM. It's also a different crowd. I think it probably is the best mix of data and tech focused people, health focused people, and then policymakers and people in government who really do help set some of the rules and regulations that make all of this go. While ARM is more heavily, I'd say, a researcher crowd. And while I love ARM, and ARM is fantastic, this is a different meeting. I'd say it has a completely different vibe. I'm really looking forward to it.
Well, I think one of the things that I love about ARM and Datapalooza together is, and I think this is a credit to, in general, to Academy Health, is that they are patient-friendly conferences. They do have, stuff for patients. I think the things I like about ARM is it moves around every year. So you get an opportunity to go to Chicago or to Las Vegas. And I think that actually it makes it easier to attend because you might be able to go to your local, ARM almost. It's like they came to my city. And Datapalooza has always been in DC precisely because it is the nexus of tech and data and policymaking and government. And we've had other governments come too. We had NHS has participated in the past. And so it really is trying to get that policy perspective. But it does mean that if you're not in DC, you have to travel to DC. All of those things being considered, when you think of the attendee, knowing that it is a different audience, what do you think will be, what you hope to be, the takeaway from Datapalooza?
So I think one part of it is that I hope you'll leave with a sense of optimism, personally. The potential of what we can accomplish. Again, this is about focused on real world things that both the public and the private sectors working together can accomplish. I think too many other meetings might focus on one or the other, but we really want to really bring together that bridge, how government and the private sector, how the private and the public can work together towards a better goal and can work together, in all kinds of environments. I also think what we really want people to leave is a better sense of where things stand from a policy perspective. You'll be hearing from high-level federal officials and presentations from people from ONC about things as specific as HDI2 rules, and you might hear from HHS data officers about recent data developments in their own agencies. That's the kind of thing you wouldn't get, I think, at an ARM, and you might not get at many other meetings. But really, it's that bridge, that coming together, that how do we all do this and get through the roadblocks and figure out how to solve problems so that we can actually do things again in the real world that makes Health Datapalooza so special.
So we will be we're recording this on the Friday before the Tuesday that is Datapalooza. The Monday is when we're planning on releasing this video. On Monday night, we will have a walking gallery, which is this patient art movement where patients and other members of the community will paint their jackets in order essentially to encourage conversations about what your experience is with the healthcare system, which is I think the most successful patient art movement since the AIDS quilts, and probably the only two patient art movements that have risen to preeminence. And I think this will be like the fourth or fifth walking gallery at Datapalooza. Datapalooza and ARM have, and I have to apologize, I'll promise to put it in the show notes, but there is some certification for being that the patients put out for being engaging. Both ARM and Datapalooza have that. This stream is intended to be something. There's a lot of patients who can't make the conference or any conferences because they're at home, they have other immunocompromised, they don't have a budget for travel. And so I think Academy far and away does the best job of making its conferences accessible to patients, to people who want to be there but can't. This stream, these video recordings, are the next thing we're trying to do that even more. Having said that, I think you coming into Academy Health, you've got new ideas. How do you think in the future you'll be working to ensure that your conferences are as inclusive as possible?
So I think part of it is what you just were talking about, that inclusivity means, thinking in all different directions, not, just in the typical directions that people think of. So with, the criteria for saying that your patients included, um, requires involving patients in the design and the planning of the conference, to having speakers who are patients, to having patients attend, and even trying to provide access to financial support for travel and accommodation to patient groups. And one of the things that Academy Health has always been super proud of is that we've met that criteria since the first meeting in 2016. We do a lot of work at our other meetings as well, but Health Datapalooza especially has met patients included criteria, almost for a decade. As long as we've been basically having the conference. But we're also continuing to work and make sure things are improved. We make sure that disability requirements can be accommodated, and we absolutely do that. We also want to make sure that our speakers and our sessions reflect the diversity of perspectives and lived experiences that exist in this world. We try to avoid some of the problems you might see at other meetings, especially in tech conferences, where you might have manels, where it's just all male speakers. We work with patients and with other groups to make sure that this is a meeting where all different voices are represented, where all different perspectives are recognized and valued, and where we can get as many people from all different areas and all different lives into the conference so that we can all grow and learn together.
So we lost Mighty Casey, who was for years on the planning committee for Datapalooza.
Yep.
We've named the patient scholarship after her, and so and I think Regina's coming, and she's going to be painting the conference, and we're going to be trying to sell prints of her work, and we're planning on using the funds from those prints to fund patient scholarships. There are already patient scholarships, but yep. I think that's an incredibly important thing to mention, is that we really want to honor the people. And when you're participating in the cancer community, losing people is kind of a fact of life and part of the process. And so there will be a little bit of mourning that happens at this particular Datapalooza around that. I sent you over 3 questions. You have knocked them out of the park. Thank you so much. Is there anything else you want to say about your experience at Datapalooza? I just want to open the floor for you if you have anything else.
Well, I had the privilege actually to meet Casey. I'd never been to Datapalooza, but I met her at a number of PCORI meetings, amazingly enough, where they've also obviously had a real focus on patient-centered inclusiveness, and obviously even in the name. But we'll all miss her and her amazing contributions. I think that again, Datapalooza is just a completely different meeting, and I'm excited to get to be a part of it, and I can't wait for it to get started. It's part of Academy Health lives and breathes data as well. Our mission is the promotion and creation and use of data and evidence to improve health and healthcare. And data is right there in the description. And we're growing our focus on data right alongside the field. In fact, in our most recent member needs survey, data access and use came up as a key challenge for the field, and something we know health services researchers are eager to learn more about. We've been offering more data-related resources and webinars. Our newest one is an online course, which we call Leveraging AI for High-Impact Health Research, and it's designed to help professionals transform their approach to healthcare delivery, research, and population health through data science and artificial intelligence. And even our non-data specific conferences like ARM have tracks and themes that are related to health data and technology. We just, this week, I guess it'll be last week perhaps when this actually goes up, started recruiting for a data portfolio director even to join the Academy Health team. And so we recognize, along with everyone, that data and artificial intelligence and technology, these are essential tools and will absolutely be part of the way that healthcare is moving, and they have such potential to improve the ways that we both study and improve health and healthcare. So I just couldn't be more excited. I'm just really looking forward to it. Looking forward to seeing you there. And I think this is going to be a great meeting.
Thank you again for making time for this. And listen, if you're out there and you know how to work with AI and data, watch for that job
Yeah.
coming to Academy Health. I know that CMS is going to be there making announcements about how they want to talk and think about AI. I think there's about a third of the tracks include or mention artificial intelligence. So if that interests you, definitely do that. There will always be a benefit to going to a conference in person. And
Yeah.
I really look forward to your opening keynote and all of the in person content. But I really appreciate Academy Health and you, kind of putting some content out there that is, I don't know, a slice of Datapalooza for
Yeah.
people who can't make it. I think that's super important. And I want to really thank you for helping us with that.
It's our pleasure. Thank you so much for your working contributions as well.
All right, thoughts. Talk to you there.
Perfect.